Over the past few years, there have been rapid increases in the volumes of medicines received and demanded by health facilities across the country, and it is against this background that Ministry of Health and the National Medical Stores sought to expand storage capacity at the central level to manage supply chain demands. Now in final stages of completion, the new warehouse project in Kajansi will improve the storage capacity with an additional 30,000 pallet locations of warehouse space, which is almost 3 times the current capacity at Entebbe National Medical Stores headquarters, and sufficient office space for more than 200 National Medical Stores staff.
The opportunity with the new Kajansi warehouse for National Medical Stores is that it is a much larger facility, giving us almost 4 times the capacity that we have been having at Entebbe. We are talking about at Entebbe having a capacity of approximately 8,000 pallets. But as regards Kajansi, we have an opportunity for 30,000 pallets. And so that is a capacity of approximately 4 times as much. And that opportunity gives us a chance to provide more space for our drugs. We can accommodate better buffer stocks. We can make sure that our programs, like especially malaria, tuberculosis, HIV, AIDS, reproductive health and others, immunization, have better stocks, and we have better capacity to store this. We are also taking advantage of the fact that Kajansi has better IT facility. We have introduced a comprehensive IT facility to be able to track our drugs wherever they go.
When we started with all these innovations and we delivered it the last mile, we remained with the challenge of sharing this information with the stakeholders. It is only us who knew. I would know, and I know now, I can tell you that from morning or for the time you have been seated here, I can tell you where we have delivered. And I can give you the telephone number of the person who has received our supplies, and you can call him or her and confirm that they have received these medicines. I have it on IT through our own innovation here with our IT team. We have had tools. We have a tool now called the DMT, the Delivery Monitoring Tool. So it will alert people and tell them when we are dispatching a vehicle. So if it is going to Arua, or Mbale, or Hoima, it will give you a notification. The DHO, the RDC, the CAO, and we tell you we are coming. The truck which has your medicine has left NMS.
This warehouse today that we see was financed by the Global Fund and also co-financed by the government of Uganda to see to it that is completed. And I think this was a very good example of synergy, between government and then the development partners to see to it that something very good like this can come up.
The project delivery method used was design-build, where ideas from the different staffs were consolidated into user requirements and the concept developed, and then both the detailed design and construction functions were undertaken by one contractor. From this, the contractor delivered a green building with installation of energy-efficient solutions like the use of solar energy to run the building and natural light instead of artificial power-consuming bulbs. And a solar system of 300 kilowatts of energy has been installed, sufficient to cover 50% of the power demands of the building. Other key facilities which have been taken care of include 2,600 cubic meters of large volume cold room area comprising of 7 cold rooms and 2 freezers, an oxygen plant able to produce 100 cylinders per day. Other amenities for staff include creche and daycare center for kids below 2 years, gym for staff, and a first aid room. The scope of the contract also included supply of warehouse equipment, which included a racking system for 30,000 pallets on location, 4 forklifts, 4 very narrow aisle tracks, each less than 2 meters wide, and a conveyor belt and gravity roller system for fine picking area. Most of these installations have been consolidated into the building management system for easy monitoring of the building and other fitted gadgets like temperature, flood, and humidity monitors. A fully equipped data center was also provided, plus other ICT equipment including computers, laptops and printers. With this, the facility will be one of the biggest in East Africa, if not the whole of Africa.